The intersection of mission and margin is the business of healthcare. Corina Tracy, Blake Marggraff, thank you so much for joining the business of healthcare today. You've probably spent more time thinking about death and communicating about death than, most of the U.S. population. What is different about the way you think about death?
I think in terms of medically possible. When I was a nurse at the bedside, both inpatient end-of-life care and outpatient end-of-life care, I ran into so many times when I would speak to the physician and they would be talking about prognosis. They would be talking about weeks or months. And when I would get to the bedside of the family, they automatically interpreted it to be years. Yes, miracles can happen, but it's not, likely medically. And so I view a lot of our health care as opposed to, the 5% that, or the 1% that, yes, you could have a cure. I view of what's mostly medically possible. And it makes me, just view the whole system differently, understanding that, I'm going to come to that time in my life, and I'm going to be most interested in, not what's just slightly possible, but what's medically possible. And I would say what makes me view it different, I've seen a lot of suffering. I used to, when you're 22 years old and you're in end-of-life care, you have to really quickly decide if you can come to grips with your own mortality or you need to find a different career, right? Yeah. Most people at 22 aren't thinking about, I someday am going to be here, right? That's just not the way that life works. And I learned at a very young age and very early that there's a lot worse things than death. What I learned also very quickly is hospice makes things so much better. I oftentimes would leave, somebody's house and think to myself, what would they do right now if they didn't have hospice care?
Yeah. You're a young entrepreneur. You're in this space of health tech and entrepreneurial, venture funded. You're also a pretty compassionate guy. What's the hardest part of connecting the dot between what you might feel as mission versus what you feel around the growth and development of your business? Where's the conflict in what you do?
It's a good question. I think that most of the people with whom I interact, call it the executive level of a lot of healthcare systems, are compassionate. That's why a lot of us pursue healthcare. It's one of the easiest ways to make an enormous impact, if you do it correctly, on a lot of lives. The biggest problem is incentive structures. And I think we acknowledge that that's true, but the fragmentation of the industry combined with a lack of clear incentives through that process really slow down innovation. The solution, and I think the reason that I take an evidence-based and evidence-first approach to product development is it often doesn't feel safe to innovate in the face of lots of risk and lots of uncertainty. And unlike pharmaceuticals and devices, a lot of technology out there hasn't been shown to really drive value. So the biggest barrier that I face is the one that I have intentionally designed this company to solve, which is it's darn tough to innovate in healthcare unless you know exactly what you're doing.
Unless you have the evidence to prove the efficacy of what
Correct.
You're doing.
Yeah.